And now I am really charged up to about this discussion today. I stumbled into Alfred Poor's writing, and when I saw some of the different ideas that he was presenting and his wealth of knowledge, I knew that we had to try to get him on, and we were lucky to get him. So let's welcome Alfred Poor to the stage. And Alfred, I feel like you could probably do a better job of hosting this than me, but I'm going to do the best job that I can. Before we dive into the topic of the future and of health technology, let's get to know you a little bit better. Tell us a little bit about yourself.
Sure thing. So thank you so much for sharing this opportunity with me. And I love what you do with the show. I've watched a bunch of the past episodes, and it's a great service. So thank you so much for that. My background is I have a checkered history. I started off as a middle school science teacher and ended up being a technology expert, wrote for PC Magazine about computers for over 20 years. I was an expert in display technologies, so I got involved in flat screens and televisions and when they came along. And as that petered out, as people became better informed about all that, I was looking at what comes next. And so this was about 9-10 years ago, and I said it's going to be wearable technology. But I wasn't interested in wearables just so people could exercise more and, that sort of stuff. I was interested in the health and medical applications. And so a friend of mine started a series of websites and newsletters and offered me the opportunity to be the founding editor of one of them, Health Tech Insider. He'd had enough fun after a couple of years, and so I bought it from him. But it continued right up until this May. We published more than 3,500 articles over the 9 years, and that gave me the opportunity to have a really broad and deep exposure to what's going on and what's coming over the horizon in this whole health tech industry. I go to CES every year, typically meet with at least 100 different executives from companies all over the world, from the major big ones like Merck and Philips down to little university labs that are doing amazing things. And so so I had this sort of broader view than a lot of people have, and that whole context leads straight into aging in place, because the aging in place issues, basically, you could say this about aging in place or healthcare in general, but basically, we don't have the resources to do it the way we've been doing. There are not enough people. There's not enough money. We can't. It's not sustainable using the models we have. And for me, the way out of the box is technology. Just as the wheel allowed us to move more stuff with less effort on the part of people or whatever, technology through the years has been a force multiplier to make us more efficient at the things that we do. And so it's my belief that the technology that we have available and that's being developed is going to make us more efficient. It's going to take the burden off of the caregivers. It's going to make aging in place safer. It's going to make healthcare treatment more effective because diagnosis will come earlier and be more accurate. So treatment can start sooner and be more effective and lower the cost. I mean, and the quality of life for everybody involved is going to be better. So that's why I'm such an advocate about health tech and the role that it can play.
I love it. What a background. And so Health Tech Insider, it's still online.
I've left it online. We're not updating it.
Okay. Yeah, there's some great articles on there. I will drop that into chat for everybody. What is the what is your current home base? What website can
well, for my speaking, I do keynote speaking and professional work on that both online in virtual events and also on, in person. People can reach me at alfred@alfredpoor.com, and alfredpoor.com is my website. So it's all
Got it.
all pretty easy.
Yep. Okay, excellent. Well, now, as you were talking, I've heard, we've all heard this, and it's sort of, hey, we need tech to enable us to, better care for our loved ones and age in place and this, that, and the other. And then, inevitably, I get the questions like, oh, geez, I don't want robots taking care of me. It's inevitably folks sort of dive into this, taking the human touch away. But
let me push back on that attitude. Okay. One of the things, I help people make better impressions in online presentations. And one of the things I point out to them is we're wired for the unfamiliar, to be afraid of the unfamiliar. All right. You hear that noise at night. You don't know if it's a saber-toothed tiger that's going to jump out and eat you. So for good reason, we're cautious about things that aren't familiar. But talking about removing the human touch, I would challenge people on, watching this. How many of you still have a washerwoman come get your clothes? Right? Give them that human touch, right? No, we use a robot. We call them washing machines, but we don't call them robots anymore because they've just become part of the background and we're familiar with them. And yet they're robots and they're very smart. I mean, the digital ones now do. I just saw a new device that's a washer and a dryer in one unit.
I saw that too.
We're thinking about getting one because
yeah, I mean,
why not?
What a brilliant idea.
Exactly. So be cautious about change. Be cautious about technology. Go in with your eyes open. Don't just accept things at face value, but understand that the good stuff. I mean, nobody advances the choke on their car every morning when they try to start it, right? And in fact, it's tough to buy a car with a manual transmission these days. We have robots doing all kinds of stuff for us and computers, and we don't see it because it's melded into the background and we just accept that as part of normal life.
All right. I love it. Okay. So share with us, what are some of the things that we should be thinking about? Are there any products, or is there a way of thinking in this space? Well, and actually here, I love, folks, I love it when you hit us with questions. I got a million questions for Alfred, but it looks like Faith has one, and it says, is there some type of program now in which I can download my medical history and health conditions, as well as my social issues, age, marital status, history of obesity, and have a valid science-backed info to suggest medical problems? I've had ovarian cancer and it was never on my radar, and it should have been. Man, great question, yeah. Faith and Alfred.
So we'll jump ahead and address this.
Okay.
Because this transcends aging in place. I mean, this is about health for everybody at all ages. The good news is that big data and artificial intelligence is getting really good at sifting through these, not mountains, but continents of data, and pulling out the little bits of useful information. We're not there yet. Okay, this is coming there, and we'll have the data from our clinical experiences with doctors, and that we'll also get the wearable data. There'll be all kinds of information that will go into this. And the other one that you mentioned about your social issues, a big development in healthcare in the last, I think, 10 years is the whole concept of social determinants of health. The clinicians are awakening to the fact that it's more than just diet and exercise. It's where you live. Are you in jeopardy of not being able to have enough food? Are you at risk of losing your home? And now one of the things that I think is wonderful is they're recognizing that internet access is a social determinant of health.
Hmm.
And my hope is that we will move more towards universal internet access, because it's such a pivotal point for the data to flow in each direction. Telehealth depends on it, so forth. So we're not there yet, but it's definitely coming. There's a lot of exciting incidents and case studies that show us moving in that direction. But yeah, it's something that we should be working towards, but we're not there yet.
Yeah, and you know, because you brought up technology for aging in place, and then this question and talking about social determinants of health, it's one of these things that I feel people are more open to after the pandemic, is at how social isolation is not healthy. And so that individual who might have been digging their heels in and saying, I'm never leaving this house, I'm staying put, they're more open to, if they are going through a period of social isolation where maybe I do need to make a change. But one of, I think, the exciting things, Alfred, is that change may not mean that you need to go move to a senior community. That change may be that you're utilizing technology in a different way to minimize your isolation.
Exactly. And you know, a little bit later on, you know, we can dive into that a bit more. But it's the point that I want to underscore here is that social isolation. I think a lot of people don't realize it, but in England, they actually have a cabinet position for the Minister of Loneliness.
Oh, wow.
So they recognize that loneliness, isolation is, again, an important social determinant of health. It is a clearly documented precursor to all sorts of mental and physical ailments, conditions that are avoidable. And I'll just throw one other little piece in there. One of the key causes of isolation among seniors is hearing loss. Right? They get tired of saying what, and their family members get tired of answering them. And, you know, and so they just withdraw and just don't even engage in the conversation. And so they can be in a crowded room and be totally isolated and alone.
Yeah.
And one of the huge developments in the past couple of years is the whole development of over-the-counter hearing devices. We don't like to call them hearing aids. Hearing aids is typically reserved for the products that require a prescription, that require a professional audiologist. But there's and that typically is required for people with a pretty acute hearing loss. But people with moderate to mild hearing loss can now go into any drugstore, can go into Best Buy, can go into Target and find devices that aren't big, obvious things hanging off your head, convenient to use. Some are rechargeable, some require replacing batteries, but they do things like noise cancellation, get rid of the background noise. They do beam steering so that they can focus in on whoever is talking. And they're affordable. We're not talking the, you know, $4,000 and up for a set. You know, we're talking 400. In some cases, some of them are way less than that. So if you think you might have hearing loss, if you have a family member or somebody that you're a caregiver for who you think has hearing loss, you don't have to wait until it gets, you know, serious, really serious. Try some of these things early, and you know, if they don't work, you can return them. But you don't need a doctor's appointment. You don't need a hearing test, and some of these are, you know, because we've covered these a lot in the Health Tech Insider. They're still, you know, those articles are still up there if you're interested in this topic. A number of these over-the-counter things are way better than the expensive hearing aids of 10 years ago. I mean, they just do magic.
And I dropped it into chat on August 2nd. We're going to have a discussion with a nonprofit that's helping make these even more affordable to folks. So tune into that. Well, I see we're getting a bunch of questions because we've been dropping the wearable thing. Give us a kind of a definition of what is a wearable and what are some of the ones that we might be looking into?
So before I get to that,
okay.
Before I get to that, one important piece of this discussion is I break down aging in place technology into two categories. Okay. And to talk about products is to get ahead of the is to get ahead of the process, because before you need a product, you need to know what to fix. And before you know what to fix, you need to be monitoring what's going on in the person's life. And the way that I like to talk about it is, hang on a second. Why am I, oh, there it is. Sorry, I had a pop-up intrude on me. I apologize for that. Well, in any case,
it's okay.
So for me, the whole question of impairment is what puts seniors at risk living independently. And it can be a physical impairment, or it can be a cognitive impairment. And so in theory, see, it looks like my camera has frozen. So
yeah, there you go.
There we go. We're back now. Good. So in theory, there's some sort of arbitrary level of ability below which you need attention. You need some help, right? So the problem comes when you ask the senior, how are you doing? Because as a senior myself, I will tell you, we are terrible at telling you how we're doing, because it's always going to be, oh, not so bad. I'm okay. You know, I'm a little slower. You know, got a little more pain in my hip, but it's no big deal, right? So, as also, I should share with you that I'm a senior, but also I'm a caregiver for my mother, who is 102.
Wow.
Lives by herself in a single family home with no immediate neighbors. And she's 6 hours from here. So a lot of these issues are very real for me, right? I did get her to stop driving a few years ago. So we did manage to cross that bridge safely. But so the thing about the impairments is they can happen gradually over time. Think about arthritis. You know, it takes a little longer to get from the bedroom to the bathroom or into the kitchen, or, you know, your eating habits decline slowly. You know, you're not buying as many groceries. You're not eating the foods that you should be eating. And the problem for us as caregivers and family members is that we move the goalposts, right? Well, it's not that bad. Well, yeah, okay, she's losing weight, but, you know, it's not that bad. She's okay, you know, and so we tend not to see this. And that's why, for me, you want objective measures of what's going on. Now, so the slow decline can be, again, physical, arthritis, something like that. It can be cognitive. It could be dementia or other forms of cognitive decline. On the other hand, you also have the situations where there's a sudden decline. So physically, it could be a fall. Cognitively, it could be a stroke. But so without understanding what's happening and what the needs are, you can't try to compensate for them. And some you can't compensate for. Some are going to require a dramatic change in lifestyle or treatment or whatever. But so that's my preface to talking about any of the kinds of things you want to do. So the first step is monitoring. How do you monitor against against these impairments. And the classic is what they call a PERS device, a personal emergency response system, right? It's that infamous "help, I've fallen and I can't get up" button.
Yep.
So those are good products and they do what they do well, but you have to understand their limitations. According to a number of studies that I've seen, where seniors who had access to a PERS device and who got into a situation where they clearly needed assistance, what percentage do you think pushed the button?
Well, if our audience wants to chime in on this, but I'm going to take, okay, Janine says 15%.
Mm-hmm. Any other guesses about this?
Susan is 10, Steve says 3. Yeah, I bet you somebody has done an internet search already.
Yeah. Well, so we're as we should, we're closing in on the average. The average of the studies that I've read is about 7%.
Wow.
So less than 1 in 10 times. Now, I totally get it. It makes perfect sense to me that they have this reaction. Oh, it's not that bad. If I lie here for an hour or two, I'll be okay. And I'll get up. I don't want to bother anybody. I did something stupid and I'm embarrassed. I don't want somebody to know that I stood on that stool when I shouldn't have. But the biggie, I don't want my children to know.
Yeah, absolutely.
Because if they know, then they'll think I can't live alone anymore, and they're going to make me go someplace I don't want to go. And so there's a good reason. So as the adult child of a senior aging in place, I'm fine with the emergency button, but I want a passive system too. And so there are lots of alternatives for passive monitoring in the home. Some of them are wearables. That sort of the gold standard for a wearable watch for seniors is a watch from Unaliware, 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 the Conego watch.
Yeah,
and
we actually did a discussion with them.
Did you? Yeah,
so
I've been following them since before they had a product, and they've done amazing things. They've done a lot of things right. For most people, that's the BMW. It's does a lot more than a lot of families might need. Oh, the other thing I should mention here about the monitoring is all families are the same in different ways. By which I mean, there's no one solution. I can't tell you the one thing that's going to work in your situation, because it's different. One person is going to be perfectly happy to have a camera in the home so that their children can pop in and view what's going on. Others will say, absolutely no way are you putting a camera in my house. So when my mother was first getting more aged and I was getting concerned about this, we had the conversation of, well, if you should fall, if something should happen, how long do you want it to be before somebody knows? And she said, 2 or 3 years. I mean, I'm sorry, 2 or 3 days. Excuse me. 2 or 3 days. Well, even so, it might as well be years. So she's a bit of a crusty Yankee, and needless to say, that was not an acceptable solution for me. But different, some people will want help right away. Some people will be willing to extend it. So there's lots of devices you can get. There are systems that can have, just like you have sensors on doors for your home security system. There are companies that have those kinds of sensors that you can put on the refrigerator, on the bathroom door, on the bedroom door, and be able to log when those are opened or closed, and can give you a lot of information. For years, I was using a device in my mother's house that was meant to detect leaks in the water system. It had artificial intelligence built in. Over a period of weeks, it would learn what's normal. You attach it to one place in the house, but it would learn to recognize what's the kitchen sink, what's the upstairs toilet, what's the shower, what's the washing machine. And so it logs all those activities. So I was able to check in every morning and every evening to make sure that she was up and about and using the different devices. We've since replaced that with a sensor-based system in a couple rooms that records activity, and so that I'm able to check to make sure that she's doing her normal daily activities and is okay. But some people may want something with a faster emergency response, and those systems typically have a subscription requirement, which raises the total cost of ownership. But some of them rely on a call list that you provide of caretakers and family members and whatever to call an emergency. Others go to a staffed call center built to handle these the calls, and who can call emergency services if necessary and so forth. So there's a whole spectrum of solutions there. So so within that don't expect that there's a one size fits all. And you want to be able to have an objective measure of the physical and the cognitive impairments as they occur.
Yeah. And I think there's sort of two kind of, there's a couple of different, there's the sort of what we refer to as the crisis situation.
Yep.
I'm concerned mom is falling down and, she needs help. And this is where a lot of those older, a lot of our family members who we present them with the PERS or the Kanega watch, it's sort of like, wait, what do you think? I need something like this? No, I'm fine.
Yeah.
What gets me excited is the developments with the products that we're all wearing, the Apple Watch, the Oura Ring, and you were talking about, as you were talking about the smart technology to see if your appliances and things like that, like these are things that that can benefit all of us, so that as we go through life challenges, which may or may not be age related, it may be that you have an injury and you're going through rehab. What are the big tech, Apple and Aura and these companies, are they sort of, is this on their radar, the needs of older adults and their loved ones?
Yes, with limitations.
Mm-hmm.
So I got to preface this with, there is a whole class of solutions that I disqualify summarily, with no argument. And that is, especially for seniors, I mean, it varies individually, obviously, but once you start getting into the 75, 80-year-old range, if you're depending on a smartphone to be part of the chain, you're probably making a mistake.
Yeah.
Because as you get into those ages, you have to keep it charged. You have to keep it updated when the software needs to be updated. You need to reboot it periodically. And I'll tell you, for many of the seniors I know, and even people with strong tech backgrounds, they lose it, and they have to be told over and over again how to do some of the simplest tasks. So if the system requires an operating smartphone in the house, it's probably not a long-term solution. For us individually, who are comfortable with our smartphones and still functioning well, they're wonderful. I mean,
but Alfred, like case in point, as you were talking, I was on a large group ride with my cycling club this weekend out of town, and we had a horrible accident. And the gentleman who was completely unconscious had a smartphone, okay? But check this out, folks. It's not just falls that an older adult is going to happen. Our cycling computers now have sensors to determine if we have a crash, and family is notified and 911 is notified. So if somebody is out riding their bike out in the country and has an accident, if they have the proper tech, that fall is being sensed, being sensed. And this is exciting stuff that eliminates the stigma that this is just for older adults.
Yeah. And the advantage of the home monitoring systems now, typically in my view, the ones that work best don't require contact with the individual. They're systems that are using radar, using cameras, and then analyzing the image, but so you don't, not showing the video, but analyzing the motion within it. A bunch, there's even technology that can take the Wi-Fi signal in your home, and as you move around, you change how the signal flows. And so there's technology available to monitor individuals within a room just based on how the Wi-Fi signals are affected. There's no commercial products that I know about yet, but they've been demonstrated for years. Not only can they identify individuals, they can typically identify whether they're standing or sitting or falling, on the floor. They can do heart rate and possibly respiration rate. So we're getting to the point where these non-contact kinds of monitors are not intrusive. You don't know they're there, and but yet they can provide all this kind of information and trigger alerts based on the data that they get in. So just like your cycling thing, and the new Apple Watch detects crashes, but again, for me, you need to choose a long-term solution that's not going to require the person in the home to maintain it.
Great.
That's the big issue.
And actually, folks, if you check chat, Jim Bland has dropped in a solution there, Never Home Alone. And then I just dropped in a product that we had a talk on called Stack Care. So those are a couple of choices if this is a topic of interest. I'm looking at the clock, and I knew that this was good. We'll probably go a little bit long, folks. Yep. This is recorded. So,
let me pick out a couple use cases that I think are most critical.
I love it.
Number one, medication adherence. We spend about $3 billion a year on unnecessary healthcare costs just because people don't take their meds. And this is a big problem for seniors, because it's easy to forget whether they took them or didn't think they took them and they take them again, or, there's all kinds of problems that go with this. There are many different kinds of solutions, from a robot that sits on your counter and does facial recognition to make sure you're the right person, and then will dispense the pills in a cup for you to take, which also provides a record of you taking them, which is, things. And then you get all the way down to smart pill boxes that can record when they've been opened and shut, and so forth. So there's a whole spectrum of solutions depending on what your needs are. But that's one of the ones that, even if there's no major impairment, it's something you probably want to look at, because the average senior takes 5-6 different prescribed medications every day. So that's the one that I would go for first. The second one is fall detection, and Kanega Watch has it. Some of the other devices now have fall detection built in. A lot of these remote monitoring systems will do fall detection. So given two systems that you're looking at, and they're equal value, equal cost and everything, if one's got fall detection, the other one doesn't, go with fall detection. So those are two of the biggest ones that I would make sure you focus on.
I love it. All right, let's dive into these topics here, or these questions here. And let's see. Somebody asks, are you familiar with the mood rings and stress dots that change colors with stress levels and body temperatures, health conditions, even litmus strips for testing body fluids? Any thoughts on these?
Sure. So,
Okay.
so I have this saying that health technology will succeed only when they disappear. So what I mean by that is the more you have to pay attention to them, the more they demand that you fuss with them, the less likely it's going to be a long-term solution. I mean, we saw this in the early days of the Fitbits. People would use them for 90 days, 6 months, and then they'd go in the back of the drawer and never come out again. So you want systems that don't require a lot of intervention. The second thing is you need to make sure that the device is measuring what you think it's measuring, and whether or not that information actually has any practical value to the choices that you're going to make. And so some of these mood rings and things like that, relatively low tech, are just thermometers, and pretty crappy ones at that. And so they don't necessarily give you reliable information or information that's all that useful. Now, some of the high-tech rings like the Oura ring, the NBA actually used the Oura ring to determine whether or not their players had COVID infections before any symptoms showed up. And this was based on solid science. They had enough data, they pulled it all together and say, okay, when we see this combination of readings, it's a high percentage likelihood that they're infected.
Or the flu or a cold. I mean,
Right.
It's predictive health by using this data. And it sort of addresses that first question of that talking about breast cancer or what have you, is the more that we can gather data from all of us and see these various changes.
But it has to be reliable data.
Yeah.
Okay. I mean, again, that comes back to, are you measuring what you think you're measuring, and is that of any use? Now, one of the, mentioned test strips for blood glucose, and we could do a whole show on diabetes and other chronic conditions because there's just so much great stuff happening there. But at CES this year, Withings, which is a connected health device company, they do smartwatches, but they also do smart scales, weight scales, and a bunch of other devices. They have a new product that you install in your toilet, and when you urinate in the toilet, it automatically samples it and can diagnose different physical conditions and stuff from that. So, and that's what I'm talking about disappearing.
Wow.
Right? You don't change your daily activities. It just happens. Currently, there's a limited number of things that they can, different modules that they can provide that detect different things. But to me, that's where I think we're headed, where, it just, you just live your life and it will give you data that is scientifically solid and that's actionable, as opposed to a lot of the baby monitors out there.
Mhm.
They tell newborn parents who have no experience with children stuff that they don't need to know and don't know how to deal with. My baby's heart rate. Well, is it, what's normal for a baby? It's not the same as for adults. Breathing rate. There's a whole lot of things that babies do that are alien to adult physiology. So it's got to be solid science first, and then give you stuff that's actionable. But you're right, gathering all that data, solid data, is illuminating and can change lives.
Okay, so now I knew this question was going to come in when we started going down this rabbit hole, but it's on. So does or will health insurance cover some of these social determinants of health, life factors, technology, what have you? I'm going to copy, Jenny shared a response to that question, which I'm going to share in chat. But Alfred, what are your thoughts on where
it's already happening? So CMS is the Centers for Medicare and Medicaid Services, and they're the ones who have to come up with the codes that allow insurance companies to pay for different processes. One of the big challenges for new tech is getting CMS to list the process. I give the VA gets a lot of grief for a lot of things related to healthcare, but I give them a huge amount of credit for making telehealth possible in this country, because long before the pandemic hit, they were pushing out bulldozing down the barriers to mental health telehealth services for their veterans, and done a phenomenal job. And I think because they sort of blazed the trail, it made it possible for the other civilian, regular consumer kinds of telehealth to take hold, which, by the way, we're not out of the woods yet. We need a whole lot of state level legislation passed in order to be able to maintain the telehealth services that we've become used to during the pandemic, because those emergency provisions have been lifted for the most part. So that's just a little aside on that. But there are, so take internet service. The CMS has determined that Medicare Advantage plans may, if they choose, pay or help pay for their subscribers' internet service. Just as they do for exercise programs, gym memberships, things like that. The internet service is now part of that. I'm disappointed with how Medicare Advantage is turning out. I thought it was going to be the results-based solution to healthcare that we needed, but unfortunately, it looks like much like the long-term healthcare insurance programs. People went in there more interested in making money than getting people healthy. It may recover, but it was a good experiment in any case. But there's an example where internet can be paid for. Again, they're not required to, but they can offer that as one of the benefits of a Medicare Advantage program.
Yeah, and when we talk about like voice tech, like I think when you talk about some technology that's in the background that you don't know that it exists, it's the Google Home and the Alexa, Amazon Alexa, but it requires that somebody has an internet connection. Yeah. And so that is so, and so much of this technology isn't important. Okay. I knew this question was going to come up because I was impressed with it when I saw it, but the way that you displayed your PowerPoint, Joan Green was wondering, what is that software? And what software do you use to make that happen?
Oh, it's deep magic, deep magic. And I can disappear if I want and come back. If you want, I can even go all spacey on you, but
oh man, that's pretty cool.
But basically I'm using, that's not letting me get back. Hang on.
You're stuck in the vortex. Yeah.
Stuck in the vortex. There we go. I'm using software called OBS Studio. And it's open source, which means it's free. And it allows you to do a lot of very sophisticated kinds of stuff for online. Again, one of the things I do is I work, the executives who are most attracted to working with me on my advisor basis are founders who need more success in their online pitches. So, I recommend that they not use the Zoom, virtual backgrounds because it doesn't look professional.
Like me, yeah.
Because things appear, disappear. If you have long hair, it looks like you're in water world.
Oh yeah.
It comes and goes, which is fine for, more casual kinds of conversations. But if you're asking somebody for $1 million, you pretty much want you want to look your best. So anyhow, OBS Studio, it's got quite a steep learning curve, but there are hundreds of videos on YouTube that can help you learn the basics and how to set things up and do some sophisticated stuff. But it's definitely not where I recommend people start.
Yeah,
but yeah, it is cool.
and then Susan says, what's the best watch for fall detection? I think you referenced the Kanega watch, and it does do fall detection. And she was curious, do you know if it needs to be paired with a particular mobile phone, or is
So
it
again, the advantage of the Kanega watch is that it is a phone. And so you don't need that. It passes my test of not requiring a smartphone in the home. And Kanega watch also has the advantage of working outside the home. So once you get away from your home Wi-Fi, it's got GPS, it's got voice, the two-way voice, so you can push a button, say I'm lost. They know where you are. They can help you find your way home. So I will point out that I don't do product testing. Product testing is extremely expensive and difficult to do right. And I don't know of anybody who's doing it now. Again, my history is with PC Magazine, which to me was the gold standard in comparative testing for technology. It no longer does what it used to do. Just can't afford it. So when you ask me what's best, I have to say I don't know, because I haven't tried them all. But I will say that the Kanega watch, which is expensive, has a lot of the hallmarks that I would be looking for. Is that fair?
Yep, that's great. And honestly, in this space of age tech, there is so much under development and so much going on that I think the moment that you finished a comprehensive product test, there's going to be 5 more entries into the marketplace, probably.
Exactly. And 5 more will have dropped out.
Yeah. Let's see. Well, this is kind of an interesting, okay. And it's 1 o'clock, folks. So if you need to jump off, remember this is recorded, but Alfred, are you cool hanging on for a little?
I'm good. I'm good to stick around. Let me just double check my calendar here.
And, while you're,
I am good.
We will
till the half hour.
Okay, well, we'll cut this off before 1:15, 15 more minutes. But do smoke detectors have cameras and monitors? Like, this is more we haven't talked about smart home stuff.
Slowly I turned. This is a pet peeve of mine. The home alarm companies have all the data, right? They have fire detection. They have intruder detection. They know when the front door has been opened or closed. They know, they have all the sensors necessary to do all this. And they don't have aging in place packages. Not at the level that I want, where it's just, the service takes care of everything. They have a base unit in your home. Ideally, when you have a base unit, when you're looking at these kinds of products, if they have a base unit, it's fine if they use your local network, your Wi-Fi to connect. But a better solution is to have a cellular connection as a backup, so that if the Wi-Fi goes down, you still have a chance of it communicating by cellular data. But there is no reason why connected smoke detectors, connected home security devices can't do aging in place monitoring better than they do now. Some of the alarm companies have partnered with some of the PERS device companies and sort of done this sort of kludgy kind of mashup of the two. But I haven't yet seen anything that gets me excited about, that they're providing a comprehensive service.
Okay, some definite good questions that I want to jump on, but I want to tackle this one here. So do you provide any support or guidance for finding and getting resources of this kind of support? And I think I know the answer to that, but I want to make sure Joan Green, who's in the audience, she works with individual clients on your needs and finding assistive technology that might fit with your needs. So Joan, make sure you drop your info in, but Alfred,
Oh.
do you provide any guidance for individuals?
No, I don't. And again, it goes back to that product review disclaimer. I don't have the bandwidth or the resources that I would feel would be necessary for me to provide adequate support in that area. And there are people definitely who do that. And that's wonderful. And I'm glad they're out there because, they're focused on that as their sole focus of operation, and which is not the case for me. So but yeah, thank you for asking. But if you know anybody who has an event where they need a speaker to come talk about this stuff, I'm absolutely happy to talk about that.
Yeah, we've got, your Alfred's sweet spot is this high level, observation and tapped in on the pulse of things.
It's the conceptual level, but it's also breaking it down because it's such an overwhelming field that a lot of people are intimidated, and I'm not a techie, and there's no way to grab hold of it. So that's why this breaking it into the observation, impairment detection, and then compensating for whatever impairments there might be it hearing, med taking, fall detection, whatever those are, treating finding solutions for those specifically.
Great. And so this may or may not have been answered, but I like asking this question again. It's just like, so how do you get objective measurement of physical and cognitive changes and impairments as they occur and take place? Any thoughts on that?
Sure. So we're not there yet for what I would want, but a lot of these devices do have artificial intelligence built in, like the water sensor that I was mentioning, and they can trigger an alert when they see something that's out of the norm. It's not as specific as you might want for some aging in place situations, but the situation, the sensors that I'm using with my mother now, I can see how long it takes her. First of all, I can see when she's getting up and going to the kitchen. I can see how long it takes her to get to the kitchen. And so if all of a sudden that started taking her longer, I would notice that. If all of a sudden she was getting there much earlier in the day or much later in the day, I would notice that. And so I would know to reach out and say, yeah, are you sick, or is something going on, whatever. So it can be automated better, but there are products out there now that are good enough.
Great. Okay. Let's see. Jenny says, Alfred, are you familiar with Project Gravity and their work on codes? If there are clinicians on the call who want to get involved in developing codes for use in insurance, this is incredibly collaborative. I wasn't familiar with that, Jenny, but that might be an interesting topic for discussion here, because I see it all the time, whether it be an innovative medical equipment or innovative tech. And the first question is, can insurance pay for this? And the entrepreneur is always like, holy cow, it's hard enough getting this product launched, so that could be really helpful.
My focus tends to be on the consumer side. So I don't spend that much time looking on the clinician side. So insurance codes and that sort of thing is more that clinical concern.
Got it.
But I'm glad to know of the project.
Okay, a couple more questions and then we'll wrap things up. But I want to read this because this is pretty cool. 102-year-old mother. What a beautiful gift of life to have your mother still with you, who is 102 years old, brand new, not old. Thank you for sharing your dear 102-year-old brand new mother. So she was, and they did the calculation.
Yep. 1921.
1921.
Yep.
So that's pretty cool. Let's kind of close out on another question that's here that talks about hearing aid technology and how, you know, a lot of it is now integrated with our phones. In fact,
Can be.
can be.
It can be. I mean, that's, to me, that's, again, if it requires a smartphone to make it work, that has a limited life. But absolutely, I mean, you know, you, with the old, even with the new digital hearing aids, if you needed it tweaked somehow, you'd have to go back to the audiologist, and they'd have to take them out and program them and put them back in. Now, a lot of these, both over the counter and the expensive ones, you can reformat them right with your phone. Say, okay, I'm in a restaurant now. Now I'm in a quiet place. Now I'm, you know, in my kitchen, and it will reset the settings based on where you are. I also just want to quick acknowledge Ruth's question. I know, you know, we're short on time,
Oh,
but
no,
she asks about
on low vision.
She asks about low vision.
Yeah.
And again, like chronic disease, this one's a whole hour in itself. But there is fascinating stuff going on to help low vision. For people with no vision, you know, essentially legally blind, to help navigate. One of the most exciting things that's happening that I've seen is there are smart glasses you can wear that will connect you with a sighted companion. So you're outside and you're standing at the bus stop and saying, you know, is this the right bus stop for the bus that I want to take? And the sighted companion will speak, you know, into your ear. Nobody else will hear it, and say, yep, you want bus 231. And okay, I hear a bus approaching. Is this the bus? He says, no, that's not your bus. You know, okay, this is your bus. You get on this one. The cool flip, and there's an organization of volunteers worldwide who perform this human sighted companion remotely for people. The cool thing is that now this Chat GPT, AI, artificial intelligence engines are now being put to use. So you don't need a sighted companion for most of it. I'm in a restaurant. Here's the menu. What are the choices? Artificial intelligence can read that just as well as a human. And in fact, there's also a company now that has self-contained smart glasses, or actually something that just attaches to your glasses that will read text to you. It'll identify money, the currency, and the denominations. It will, you can train it to identify individuals by face. And so it will tell you who's in the room or who you're talking to. So, you know, it'll even find an empty seat. If you're looking for a place to sit down, it can identify where the chairs are and if there's one that's open. So there's a lot of great stuff happening in the low vision and total vision impairment world.
This is exciting. Well, and one of the questions sort of addresses, like, are there some places where folks can go to try to keep up on things like this? I mean, I've been to CES, and if you can afford to get out to Las Vegas once a year, it's amazing what you see out there. But any sort of
that's what Health Tech Insider wanted to be. It was not a sustainable project. There are most of the health tech sites around Med City. Some of those are clinician focused. And there are some sort of grassroots aging tech sites, but they're pretty limited in terms of what they can cover.
I just dropped in this Aging and Health Technology Watch by Lori Orlov. I know a lot of
people. She does a very good job.
Yeah, so I dropped that in there. Anyways, man, well, this has been great, and I guarantee. Ruth says she just met with ITG in Falls Church with assistive tech for vision impaired. That's great. And I dropped in also a low vision resources discussion that we did as well. But Alfred, I know what's going to happen is is that I'm going to get a bunch of emails after this discussion with, hey, can you find somebody to talk about what he, was talking about there? So I may be hitting you up for some companies. I definitely, we talked to Canega Watch over 2 years ago, so I want to get them back in. And let's see. So how do you bring the supporting AI low vision technology to life if your family needs the support?
These are commercial products that you could buy.
Yeah, but send me an email. I tried to do some searches really quickly, but the person with that question, just send me an email, and if I can't figure it
out. I encourage you to go back to Health Tech Insider, because for everyone I've mentioned, there's a dozen more that we've covered in recent years. So that's worth it. Also, I've put my email address in the chat again, but my door is open. If you have questions, whatever, just reach out to me. I will do my best to provide an answer. I'm always happy to help if I can.
I love it, Alfred. Thanks so much for your time today and your insights, and really, but again, thanks to everybody in the audience for these awesome questions. You guys always ask questions that I would have never have thought of, and I think it's wonderful. And let's use Alfred's talk for some follow-up discussions with some of these providers that might solve some of your families and your individual topics with technology.
And I will be happy to come back. If you want to niche down to chronic disease or vision or hearing or one of those things, I can come prepared to dive deeper into any of those kinds of categories. So if that would be helpful.
I love it. And don't forget, you can hire Alfred if you're a part of a trade association or an organization, or you want a really cool, innovative topic for a conference. Reach out to Alfred. He's got his email in there. And all right. Well, thanks a lot. And thanks, folks. And we'll see you all at the next one.